Be our study session for this morning. Hi there. Welcome to Monday Motivation, everyone. Beautiful week. Let me know if you are able to hear me. Thumbs up if you can hear me. We are going to be talking about how to pass NCLEX. We're going to have a very powerful study session. For those of you who are not aware, we have been studying Quick Facts for NCLEX. Very great book. We're going to be talking about COVID-19 today. I know you know what it is, but do you know what it is from the NCLEX priorities? But I need to start this broadcast with an apology because I said something that offended a few people and I actually got a message about it. Somebody messaged me and said, I deeply offended them when they asked me to review their candidate performance report. So somebody came on the live and they asked me, hey, can you look through my CPR and tell me what I need to do, what I did wrong, and how can I pass NCLEX, right? And so I say what I always say. And for those of you who know me, you know this is how I feel about the CPR reports that NCLEX gives you. They don't work. They don't matter. You cannot use them for remediation. And I said to them, I said, throw it away because it's not going to help you. That candidate performance report does not help. And I've never changed my position on this. But when I said it, they were really offended. And so I need to apologize, which I did straight off. I'm not going to not apologize if somebody says that I hurt them. But also, I want to say this because this is why I believe the candidate performance reports don't work. And write this down if you don't know, or tell somebody at least. They don't work because number one, they tell you what you already know. They tell you that you failed. Okay. You already know that you failed. They also don't give you a measure of the reason why you failed or your true understanding. I feel like if NCLEX is going to give you something after you failed, it should at least allow you to understand why they didn't allow you to get your license. Was it because you misunderstood the question? Was it because you failed to identify the priority in regards to certain situations? It's not like they don't have the ability to gather this data. They absolutely do. They could at least tell you you failed because you didn't have the clinical judgment when it came to situations of pediatric mismanagement, or you did not fully grasp the concepts of airway management when it comes to COPD patients. They could give you that, right? They could tell you that, but they don't. And so when you are looking at a very generic CPR report that everybody gets the same text, literally everybody gets the same text except for the 3 words above passing, below passing, near passing. I've seen hundreds of them. What they do is they keep you stuck in the past, and it becomes another thing that you have to deal with when you fail NCLEX. And because I'm talking to people who fail NCLEX every day, there's certain issues that make it harder for them to get started again. One is readiness exams. When people pass readiness exams, but they fail NCLEX, it creates a mental block that you have to work through. Because the question is, why did you fail? Why did you fail when you passed this readiness exam, right? The second is the CPR reports, because this is the it's the relic. It is the memory of your past NCLEX. And so it's what you hold on to because that's all you get. And so people don't want to let the CPR go because it is the last thing that attaches them to the NCLEX. So I can imagine when I said throw it away, how that must have come off to something that you've been carrying around and cherishing and looking at for months. But you got to let it go. You got to let it go because it's not going to help you. What will help you, though, is remediation. Okay, what will help you is remediation. And shout out to everybody that's on. Let me know in the comments, are you a RN? Are you a PN joining us today? I see some testimonials. This is Monday Motivation. We do this every Monday, okay? But no, for real. The CPR tells you what happened. What I want to do is help you understand why it happened and how to never let it happen again. And so that's rebuilding your content. You should always be starting there. Remediation is a structured process. PNs representing today. Okay. And so when you pass, it is because you have your priorities right. You have your confidence. And so I just wanted to start off addressing that this morning. I hope you all understand my heart, even behind my words. Sometimes I don't have a lot of time to say long explanations about why things don't work. If I say they don't work, it's coming from a place of honesty. All right. Now, with that being said, it's time to get into our study session for today. We are studying quick facts on today, and we are opening up our books. I am here to challenge your understanding of COVID-19. COVID-19. Is it Thanksgiving? Is it Thanksgiving today in Canada? Did I miss something? Happy Thanksgiving! In Canada. Let me confirm that, because we are getting ready in America. We are getting ready for Thanksgiving, and it is a big thing. Okay, it's a huge thing in America. So let's get into it. All right. COVID-19. Are you guys ready to put in the comments? This is a study session. This is a live study session. What we are going to leave here with, because we're going to spend about 10 minutes studying this. What we're going to leave here knowing is what is the most deadly part of COVID-19. And it might not be what you think it is. So let's tap into it. This is what remediation looks like too. For those of you who are trying to take NCLEX from one of the more difficult state boards of nursing, because there are difficult state boards of nursing when it comes to remediation. This is what they want you to be doing. They want you to be getting into the foundation. All right. And so I love quick facts. I think it's a great way to start, but quick facts is not considered remediation. This is a starter. Okay. Starter. I think Florida is one of the more challenging ones because they make you do remediation plus clinicals. Some states will make you do remediation plus additional things. You might have to take additional classes. You might have to get private tutoring. So at the end of it, though, what I want you to take away from today's class is what that remediation should feel like and look like. All right, COVID-19, let's go. I got LPNs representing big time today. I see you. All right, so when we talk about COVID-19, and I am on page 27 of Quick Facts. Everybody should have this book. Even if you don't have this book, just come to class today. You'll get the book and you will join in for us. Okay, COVID-19, put it in the comments. Let me hear this. When you talk about COVID-19, what type of system is involved? Give me the body system. This just to start off very, very basic. Waking you up is Monday morning. You need to study. You're here for about 10 minutes. You're going to study with me. Respiratory system, right? This is a respiratory. This is a respiratory condition. Y'all know when my kids know that I'm working is when they message me more than anything. Okay, this is a respiratory condition. So when we talk about a respiratory condition like COVID-19, I'm glad you know that. Now, the next step for me to push you on, when you think about the treatment for COVID-19, is it viral or bacterial? Let's start that. Is it viral or is it bacterial? What do you say? Viral or bacterial? Very good. Very good. I see TikTok is humming today. They got it. Viral. This is a viral condition. Now, going back to our NCLEX priorities, we always hear to check airway, breathing, circulation, right? Airway, breathing, circulation. With COVID-19, what are we more concerned about here? Which letter is most threatened with COVID-19? Is it A, B, or C? For COVID-19, is it the A for airway, the B for bacterial, not B, the B for breathing, or the C for circulation? Airway, breathing, circulation. Okay, I knew I would split you up here because I see some A's and I see some B's. I see some A's and some B's. And this is why when we read quick facts, we have to be always reading it for intentionality. Okay, always reading it. Like we're about to, what do I say? Give report. For COVID-19, we are worried about the B in breathing. We're not worried about our patient losing their airways. We're worried about the B. Yes, this book is part of remediation. Absolutely. Okay. Because you see, I'm asking questions and you don't know the answers to them. Okay. All right. So we're worried for COVID-19 about the breathing because this condition affects the lungs. Doesn't affect the trachea. And congratulations, I think I saw somebody on here say they just checked their NCLEX results and they passed ReMar nurse in the house. Okay. All right. So the oxygen can get in. It's not an airway problem. Okay. You see people with COVID and their airway has not collapsed. The problem is it is affecting the lungs. Now, this may be a challenging question, but I think somebody in here knows it. What part of the lungs are affected with COVID-19? I'm getting into the anatomy now. Quickly, you either know it if you don't know it. If you don't know it, just say, I don't know. IDK. Okay. When you talk about COVID-19, what part of the air in the lungs is affected? Good job. I see it. The alveoli. The alveoli. That is what the virus attacks. Okay. Now, we're just setting a foundation. We're just setting a foundation. So, this is why the breathing is the priority because the oxygen gets in, but it becomes trapped once it gets into the lungs. Okay. And the alveoli become inflamed. They can't do their job. So the danger with COVID-19, and I don't know if any of you have had COVID-19, but for NCLEX, this is what can happen. Now, the patient can be sitting there, feeling fine, looking good, but when you check their O2 saturation is 75%. That's the danger of COVID-19. Is that the outward appearance doesn't reflect the damage that is being done with the virus. All right. Does everybody understand that? So your patient can have what we call silent. Does anybody know? Silent hypoxia. Okay. Silent hypoxia. All right. Are you guys following me? Because now I got to go faster. Okay. Oh, Fab says my aunt died with an O2 saturation of 73%. Yes, we lost so many people with COVID-19. Yes, I'm thank you for sharing that. My prayers go to you and your family members because when COVID-19 first came, people did not understand why seemingly healthy people were not making it. And I remember going to a funeral of a 19-year-old patient, right? 19 years old. And he died in a week. And his family was sitting there. This was before anybody knew what COVID was. I know some of you may know people that had it, got so sick, were in the ICU, they couldn't even explain why they were in ICU. This 19-year-old, I'm sitting at his funeral because Mark had to preach the funeral. And the family was like, it doesn't make sense to us. We only knew him to have asthma. He didn't do drugs, he didn't do anything. Like, why? So COVID affected this young man's lungs who just had asthma. All right. Before people even knew what it was. And so everybody was questioning if the family was lying about why the son died. And they were like, no, he probably died of a drug overdose, and they don't want to say he died of a drug overdose. Okay. Man, it was bad. So, anyways, patients with COVID can have silent hypoxia. And what it is that for NCLEX, you need to understand this difference. Okay. What is the difference between hypoxia and hypoxemia? If you don't know, say I don't know. What's the difference between hypoxia and hypoxemia? Somebody put those two in the comments. Either you know or you don't know. Okay? I don't know. This is why you come to class. Okay? Because the expectation when you sit in front of NCLEX is that you have been preparing for assessments. And if you don't know the assessments, then you cannot do them. Okay? I hear that. I'm happy when I can use your book and come to class. All right, here's the teaching. So you guys don't forget this, okay? When you talk about hypoxemia, you see that emia is in the blood, okay? Anemia, hypoxemia, blood related. So that's low oxygen where? In the blood. Hypoxia, you got that one? Okay, the bell helps us to remember. Class has started. Hypoxia is low oxygen in the tissues, okay, in the body tissues. So when you talk about COVID-19, do we expect to see hypoxemia first or hypoxia first? Okay. Which one is first with COVID? Hypoxemia or hypoxia? And congratulations to everybody that's passing. It feels so good on Monday mornings when we need motivation to come and see people to say, hey, I love this. Look at this comment right here. Professor Regina, your platform and materials are second to none, exceptional, unique, and outstanding. With God, you can, you will, and you must pass NCLEX. Yes. Man, thank you so much. This is what we do on Monday. Okay, I see the answers on the screen. Some people are saying it's hypoxia first. Some people are saying it's hypoxemia first. But no, for COVID, the correct and anatomically appropriate progression would be hypoxemia and then hypoxia. So COVID-19, then you're going to see hypoxemia. You're going to see a low oxygen in the blood. And then you're going to see hypoxia in the tissues. And that just makes sense. Okay? Because the tissues are waiting for the blood. So you would never have hypoxia before hypoxemia. Never. Never. Okay, remember that point. Now that you know that. So when NCLEX says which assessment is no. That's not what I want to do. I'm going to tell you the assessment, and I want you to tell me, are you checking for hypoxemia or hypoxia? Okay? Okay? That's what I'm going to do. I'm going to tell you the assessment, and you tell me, is the nurse checking for hypoxemia or hypoxia? If you're ready, put ready in the comments. Just let me know that you understand what's about to happen. Okay. Okay. You following me? You following me? All right. Here's the activity. Here it is. Okay. Now, shortness of breath. Shortness of breath. Is that hypoxemia or hypoxia? I'm going to do question and answer after this. Let's stay on this. Let's stay on study session. And if you don't have this book right now on TikTok, we're doing a flash sale. This is quick facts. Okay. Shortness of breath. Hypoxemia or hypoxia? Shortness of breath. Correct answer is hypoxemia. Hypoxemia. Okay. Breathing. Blood in the oxygen. Okay. Together. That's hypoxemia, shortness of breath. Okay. Patient needs more oxygen in their blood. Okay. That's where it's going to come first. Okay. Let me try another one. This will be an easy one. You should get this one. Low urine output, hypoxemia or hypoxia? Low urine output. Low urine output. Good morning, everyone. Good morning. We're in class now. We're warming up. Good job. Good job. Low urine output. Absolutely. We're talking about tissue damage. We're talking about low oxygen in the tissues. Hypoxia. Hypoxia. Okay. Next one. Confusion. 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 Hypoxemia. Hypoxia. Hypoxemia or hypoxia. If a patient is confused, are we assessing them for hypoxemia or hypoxia? And you had to be here at the beginning of the class, okay, to know what we're doing. That's why you come to class on time. It's Mondays, 12 p.m. Eastern Standard Time, okay? East Coast representing. Hypoxia. Absolutely. We're talking about the brain. We're talking about tissue damage. The blood flow to the brain is not flowing, so the tissue is being damaged. The brain can't think. Okay. Tap in, tap in. Okay. How about this one? O2 saturation, 83%. Hypoxemia or hypoxia? Okay. If the O2 saturation of your patient is 82%, hypoxia, hypoxemia. Okay. This one you absolutely should get right. Okay. And if you find yourself getting these wrong because you just came to class, like you just saw me and you're trying to answer this, then that means you need some remediation. You need to slow down and you need to start coming to this class. Okay. For those of you who are getting it right, for those of you who picked hypoxemia, I want you to take note. The reason why you're able to answer these questions so easily is just because we did a foundation review first. So we talked about breathing with COVID. We talked about the difference between hypoxia and hypoxemia, right? Because the reason why this is easy for you is not because I'm giving you some trick or study hack. It's not because we did any practice questions. We didn't do any practice questions. No readiness questions. We didn't do nothing like that. It's simply because we're taking the time out to revisit fundamentals. Okay. I want to read this testimony. I'm encouraging everyone to stick to this platform because God is in it. I'm a repeat test taker 2 times, but my 3rd attempt was on October. See, this is an international nurse. How do y'all read this? How do y'all write this date? Okay, on October 4th. There he goes. And then on the 7th, it came out that you passed. Amazing. Love it. Love it. Love it. All right. Okay. Success is in this part, the part that people don't want to do. This is the stuff people don't want to do. Okay. And so hypoxemia, low blood saturation. Now, let's talk about one more. Mm, Tachypnea. Tachypnea. Is that hypoxemia or hypoxia? Tachypnea. Thank you guys for all the hearts. Thank you so much. Okay. Tachypnea, hypoxemia or hypoxia? If the patient starts breathing faster, okay, that's also going to be a sign of hypoxemia, okay, hypoxemia. So what I want now is for you to tell me if you have a patient that is their O2 saturation drops from 94% to 88%. What two things are you going to do for that patient? What two things are you going to do for that patient? Okay. If you have a patient that drops from 94% to 98%, what are you going to do for that patient? Okay. Okay. And remember, this is COVID. Okay. So the very first thing is you're going to put oxygen on that patient. Okay. Oxygen. Okay. And positioning. What's the position you're going to put them in? What's the position? What do we call it? Give me the clinical term for the position. It's okay if you said oxygen. Yes, we are going to put them, give me the clinical term, high Fowler's. Absolutely. We're going to put them in high Fowler's position. We're going to put oxygen on the patient. And what are we going to do after that? What are you going to do after that? Somebody says, call the doctor. We're going to call the doctor. That's what we're going to do. All right. Because if you have a patient and their O2 saturation drops, okay. Now, this is a good question. When we put oxygen on the patient, are we going to put a nasal cannula or are we going to put a face mask on the patient? Yes, this book is for RN and LPN. Okay. 11 minutes left. Okay. Are we going to put a nasal cannula or a face mask on this patient? That's such a good question because I didn't tell you this, but this is definitely part of your nursing scope of practice. And remember, NCLEX is for new nurses with no experience, okay? Some people are saying face mask, some people are saying nasal cannula. Okay. All right. Listen, if you are in the process and you have not passed NCLEX and you don't know who I am, I'm Professor Regina. I've been helping nursing students pass NCLEX since 2010. Okay. I'm not new to this. I'm true to this. And so on Mondays and Wednesdays, I come on here to do office hours where I allow you guys to study. We read the book together. You can ask me questions. I want you to DM me. Right now, we're doing tell me your story if you failed NCLEX. Okay. The correct answer. Okay. Tell me your story. We'll talk about it and then we will help set you up for remediation if you don't know what it is. Okay. You can send me a message. Now, the correct answer for safety is going to be nasal cannula. Okay. Nasal cannula. That is what you are going to start with for NCLEX. Because what? This is an emergency situation. You need to establish oxygen for this patient, but you are not doing the recommendations. If it's a nasal cannula, nasal cannula is what you can do safely, right? Non-rebreather mask, partial rebreather mask, all that stuff, not yet. Not yet. Okay? Not yet. Right? Let the doctor do that. You sit that patient up, you put oxygen on that patient, you put a nasal cannula on that patient. That's where some of y'all get in trouble, because you do too much too soon. And just because you know something, that doesn't mean you have the right to implement it. All right. So some people, one of the reasons why some nursing students fail NCLEX is that they overthink it. They overthink it. We're doing COVID-19. It's page number 27. Okay. And some of you guys, you are very intelligent and you may even work in the hospital. And so you've seen some things, but you cannot do what you see in the hospital for NCLEX. And that's where y'all get it wrong. And that's why a lot of nurses who have experience, they struggle to pass NCLEX. So that's LPNs going to RNs. You can pass LPN, NCLEX LPN or PN the first time, but NCLEX RN, it takes you 2 and 3 and 4 times. You wonder why? That's why. Because you thinking like a seasoned nurse, and this is not an exam for a seasoned nurse. Put that oxygen on via nasal cannula, okay? Because you're a new nurse with no experience, okay? All right. So anyways, that's what you're going to do. Any questions about that? No. All right. Let's go on. So then the next point is that once you do that, you established oxygen, you established sitting the patient up in high Fowlers, you established calling the doctor. What is the second priority for NCLEX when it comes to COVID-19? Because we can't miss the plot. We started talking about this COVID-19. What's the second priority? Okay. 7 minutes on TikTok for quick facts for NCLEX. If you don't have it, we read this book every Monday and Wednesdays. Okay. Every Mondays and Wednesdays. Okay. So the next thing is going to be isolation. Very good. Yes. Now, you got the isolation part. I have not added any knowledge to what you already know. You know these patients need to be in isolation. Now let's talk about the type of isolation. Is it universal? Is it contact? Is it droplet? Or is it airborne isolation for NCLEX? How is COVID-19 transmitted? And this is the difference between a safe nurse and a nurse that can pass a test. Okay. Because a nurse that can memorize things can memorize them for a little bit and then they can forget them. But a safe nurse knows it and never forgets it. Okay. Correct answer is respiratory droplet. Okay. So we are going to put them on droplet precautions. Droplet precautions. Now, with COVID-19, this one is very interesting because COVID-19 can also become, what's the word? It can also spread through the air in tiny particles if aerosol procedures are being done. This is what they didn't know about COVID-19, is that, yes, we were doing droplet precautions, which is correct and true. But when it came to COVID-19, when you come in with COVID-19, what type of therapies will you need? Okay. Because you're going to get your medication through your IV. You're going to get the nurse giving you pills and stuff, but what kind of treatments were COVID-19 patients getting also as well? Who else is going to see a COVID-19 patient? Not the doctor, not the nurse. We already know that. Who else is coming into the room like every 4 hours, every 6 hours to that patient? Who else on the team is coming in? Yes, respiratory therapy. Respiratory therapy would come in, and what are they going to do to that patient that's going to cause COVID-19 to, boom, spread? They're going to do what? Respiratory therapist is going to start doing breathing treatments on these patients. Okay. And when you do breathing treatments, now you are introducing aerosol therapy to the patients. And COVID-19 is interesting because it can transmit through aerosol procedures, right? That nebulizer, that aerosol therapy. And so COVID-19 can get through into a patient's body through also the eyes. Okay? Because it's droplet. So when those nebulizers and the patient would cough and they're getting a nebulizing treatment, COVID-19 is able to go up into the air and get in people's eyes and get infections that way. All right. So COVID-19 is always droplet precaution with goggles. All right. Droplet precaution with goggles. Because this can get through into the eyes. Okay, did you learn something about that? So it's not, and that's why some people confuse it and say it's airborne. It's not airborne, but it is in the air. And so the limitations of the droplet precaution from the airborne is the distance, the proximity to the patient. And so when we talk about droplet precautions, you have to be within how many feet for droplet precautions? How many feet? All right. Right. Okay. Oh, this is good. I don't know. You guys, all these different answers. Now I'm questioning myself. Usually for droplet precaution, it's 3 feet. Okay. You have to be within 3 feet. So that means if a patient sneezes on you, if a patient coughs on you, right? And so that's why this is so important for nurses, is because yes, we are in that distance range. Okay. We are in that distance range within 3 feet. Right. But I know when the protocols came out, they said you got to stay within 6 feet of people. And that's just what people held on to. But for nurses, though, 3 feet. All right. I'm moving on. All right. So what else do I want to say about this? Okay, let me ask you this question. And then I'm done here. If you have 2 patients, who's your priority? The first patient, there's 1 minute left on TikTok. If you don't have this, tap into it now. Get this book. So on Wednesday, everybody brings this book back to class. You have 2 patients. Who's your priority? The first patient is going to be a patient with an oxygenation saturation of 88%. That's the first patient. 88%. The second patient would be a patient that has an O2 saturation of 90%, but they are confused. Who's your priority? 1 or 2? First patient, 88%, or second patient, 90% oxygenation, but they are confused. Who do you see first? And this is a very easy priority question. Very easy. Okay. The safe nurse is going to see patient number 2 first. even though they have a higher oxygenation saturation, because that is the patient that is showing signs of impairment. Yes, they're showing signs of an abnormal assessment. Actually, they have two abnormal assessments, okay? Because we don't want the oxygenation to be 90%, but then we also certainly don't want the patient to be confused. Confusion is huge for NCLEX, okay? All right, guys. So for COVID-19, I'm just going to wrap it up with this. This is page 27 of Quick Facts for COVID-19. When you see that, your understanding is that this patient with COVID-19 can have silent hypoxia, which we talked about in the beginning of this study session. Silent hypoxia, which can happen so fast and very difficult to reverse. Very difficult to reverse. When patients who have COVID are put on ventilators, the ventilators are not to save their lives. How many people know that? How many people know that back in 2020, if you had COVID and they put you on a ventilator, it was literally like a death sentence. It means that they could not do anything else for you. So they were putting you on a ventilator to give you and your family, more so your family, a few days before you died. Okay. Yes, the ventilator was for a comfort measure. So the understanding that you need to have for NCLEX is that COVID-19, these patients need aggressive assessment, because you know that before the hypoxia can occur, there will be hypoxemia. And so if you can correct the hypoxemia, then you don't ever have to worry about this severe acute respiratory syndrome, right? This ARDS, like that's going to happen, where the organs will begin to fail, right? That's the hypoxia. That's hypoxia. All right. And so on page 28, so your priority is understanding that hypoxia. The second is isolation and understanding isolation. So we went over those two things for this study session. If you want to continue to read page 28 in this book, it talks about the other situations that you can have with COVID-19 that you need to be aware of, which are blood clots, blood clots, okay? Blood clots. So again, this book is to help set you a foundation. I come in just to point you out to the important stuff that you may have missed, so that when you're studying, you can have a better understanding of what your priorities are. And again, this is what remediation is about. It's a self-discovery. So when you're taking NCLEX, you're not blindsided by these things, because you have learned to remediate. You have learned to read, not overthink. Okay, you guys can do this. So I'll let you go. It's Monday. If you have not followed me, please follow me on social media so that you know when I can pop up. Also, if you have not talked to me about remediation and you need to do remediation, please send me a story. We're doing Tell Me Your Story, where you write in, tell me if you failed, how many times you failed, and then I help you develop a plan and a special discount for remediation if you are needing that. Okay. Remediation is a slower, more focused process to studying for NCLEX. So thank you so much. If you came to class and you learned a lot, come on in. I got way more than this. Okay. I got way more than this, but this was great. So I'll see you guys later. I'll say bye to Facebook and YouTube. Have a great day. My email address is right here. You can see it. Send me an email, write it down if you don't have my email address. And I will see you guys on Wednesday. Bye-bye.